Hello, my name is Dr. Srikanth V. What are cheek implants? Cheek implants are basically implants that are put inside the cheek, usually around the cheekbone, the malar bone, to give you a more fuller look there. Who are the people who need it? People who are very particular about having a triangular face but don't have enough projection on their bones, that is the cheekbone, the malar cheekbone known as the zygoma, which does not give enough projection and therefore they feel that it is flattened out. So these are the one set of people who will go in for a cheek implant. The other set of people who will go for a cheek implant are someone who's had a bad accident wherein the cheekbone is damaged and for whatever reason it was not being able to reduce to its normal place or fixed or unable to be fixed, or if it's fixed it is not sitting in its normal place and they are hollowing on one side of the face. These are the patients in whom we will do a cheek implant. The third thing is a person who wants a better facial contouring, so that they feel that they would like to improve the facial contour. So you will put cheek implants that is also combined with either a genioplasty, that is a chin job, or a rhinoplasty, that is a nose job, so that the entire contour of the face gets a more balanced and a pleasing look. Cheek implants, how are they done? They are done under local anesthesia. Can be done. I would do it under general anesthesia, but it's very uncomfortable for you to get it done under local anesthesia and sedation, because it involves an incision which is put inside the mouth and cavity is made and the implants are placed, and I would like to fix it using screws, and this is not a very comfortable situation that you would like to be in under operation theatre. So you can do it under local anesthesia, but my suggestion is it's always better done under general anesthesia. Whenever a person undergoes cheek implants, it's obvious that it is on the face and the body responds by edema, that is swelling. Now this swelling will be prominent all over the face. It will extend to all the sides. Typically it will be around the eyes, along the cheekbones, almost up to the ear, entirely up to the upper jaw level. This entire edema will take some time to settle down. It is treated with certain anti-oedema medications. You can use ice packs. You can lie down with 2 pillows up so that you elevate your head so that the edema goes down. But you should give it about 2 weeks or so before you can completely go out in public. You can resume your normal activities in about a day or two, but it will still look a little full or edematous to the people around you, and it may take about a week to 2 weeks for it to fully settle down. How long do cheek implants last? They are designed to last a lifetime. They damage, they don't break. Generally, they don't move around. However, in the first few days of surgery, they may tend to shift because of the pocket created. Then it is better to fix these implants either to the covering of the bone, the periosteum, or fix it directly to the bone. The choice is of your plastic surgeon, whether he prefers to use a suture to fix it or he uses a screw to fix their malar implants, and they will stay for a lifetime. They don't need to be removed unless there is infection. If there is an infection, then your plastic surgeon will tell you, yes, things are not going your way and these implants need to come out. Other than that, they don't need to come out. The only other reason I can envisage is that if you're unhappy with the way the face looks, you feel that it is not good, it is too prominent, or it is unequal, then you may request your plastic surgeon to remove the cheek implant or replace the cheek implant. Cheek implants. Cheek implants are basically implants that are put inside the cheek, usually around the cheekbone, the malar bone, to give you a more fuller look there. Who are the people who need it? People who are very particular about having a triangular face but don't have enough projection on their bones, that is the cheekbone, the malar cheekbone known as the zygoma, which does not give enough projection and therefore they feel that it is flattened out. So these are the one set of people who will go in for a cheek implant. The other set of people who will go for a cheek implant are someone who's had a bad accident wherein the cheekbone is damaged and for whatever reason it was not being able to reduce to its normal place or fixed or unable to be fixed, or if it's fixed it is not sitting in its normal place and they are hollowing on one side of the face. These are the patients in whom we will do a cheek implant. The third thing is a person who wants a better facial contouring, so that they feel that they would like to improve the facial contour. So you will put cheek implants that is also combined with either a genioplasty, that is a chin job, or a rhinoplasty, that is a nose job, so that the entire contour of the face gets a more balanced and a pleasing look.